Welcome to the Brimful Podcast. I'm Pamela Tessman, an IBCLC, a mother of two, and former childbirth educator, doula, and ECE. I share evidence-based tips and stories on infant feeding and the perinatal period. This podcast is for educational purposes only and is not a substitute for medical advice, so please always see your healthcare provider if you have concerns. Be sure to follow me at brim.familycare on social media or visit my website at brimfamilycare.com. Let's get started. Today, I'm excited to start the new year off with Dr. Margie Davenport. She has done a lot of studies in the perinatal period. So, Margie, can you tell us a little bit more about yourself and how you got into this work?
So I'm a professor at the University of Alberta, and I run the program for pregnancy and postpartum health, which is a research program dedicated to investigating and learning more about physical activity in the perinatal period, so from preconception to pregnancy and postpartum. How did I get into this area? Well, more than 20 years ago, I was a athlete, and when I retired, I knew I wanted to stay involved with physical activity and exercise in some way, shape, or form. And so during my second undergrad, I decided I wanted to be involved with research. And one of the few people that were doing anything related to physical activity and diabetes in that time was a professor looking at diabetes in pregnancy. So I started working with her and learned a lot about pregnancy, fell in love with the physiology and how quickly everything actually changes. And when I did my PhD, my work was actually looking at postpartum physical activity. And so we just sort of went from there.
That's so great, because we need a lot more studies being done on this period of women and pregnant people's lives, because I often go searching in my work as a lactation consultant and I'm like, we don't have evidence on that yet. So
yeah, it's pretty wild, especially when we talk about postpartum. It's almost like this forgotten time, but it's changing, which is great.
Awesome. So what have you been doing lately?
So actually just back a couple of months ago now, we released the 2025 Canadian Guideline for Physical Activities, Sedentary Behaviour and Sleep throughout the first year of postpartum. So that was the culmination of a 3-year process where we synthesized all available literature in the postpartum period, in the first year postpartum, to examine the impact of physical activity and sleep in particular on health outcomes for mom, but also baby as well. So we were really interested in understanding sort of when is the optimal or ideal time to begin physical activity. So traditionally, most people are told not to do much of anything in the first 6 weeks. 6 weeks, you would go and see your healthcare provider. They would medically clear you to begin physical activity. But in theory, you could, 6 days or 1 day after that 6-week mark, you could start running a 10K if you wanted to. But we also know that there are lots of people who are ready to be physically active very early after they deliver. Especially if they're an athlete and they really identify with physical activity. It's a big part of their life. They do want to get up and moving very soon after. And then there's other people where, 6 weeks is actually a really intimidating time. If baby's not sleeping and you're not recovering or feeling well, being told that you're cleared to exercise at 6 weeks and 1 day, is much too soon. And so one of the things we wanted to look at is, when is an optimal time? Turns out that there really isn't an optimal time. It's when you are ready and when your circumstances allow you to resume physical activity. For some, very early on. For others, it might be closer to that 1 year mark or later.
That makes perfect sense, because everybody's journey is different in terms of pregnancy, fertility, pregnancy, breastfeeding, postpartum. Yeah, there's no one right way.
Absolutely.
Wonderful. And so you reached out on Instagram because you were wanting to talk about breastfeeding and exercise, which is really interesting to me. So what do you have for us on that?
Yeah, so for a really long time, we've actually had this idea that exercise and breastfeeding actually don't combine very well. Anecdotally, especially, when I was doing my PhD work, I would hear, I don't really want to do exercise because it's going to impact my milk supply. And so with our systematic reviews and meta-analyses, so that's basically taking all available literature, lumping it together to see what the data actually tells us. And what we found was that across the studies that we looked at, that women who exercised in the postpartum period who were breastfeeding, that their quality of milk, the quantity of milk, was actually not different between those who exercised and those who didn't. And we also found that infant growth and development was actually very similar between those who were exercising and those who were not as well. The other piece is that we also often hear that women who are breastfeeding, that they're more likely to have an injury in the postpartum period. So we also looked at that relationship. And funnily enough, we actually didn't see any increased risk of having injuries if you were breastfeeding in the postpartum.
Right. And so does that have anything to do with the parent's nutrition?
Great question. So it's funny because when we talk about exercise and postpartum, we actually have fairly limited information about physical activity, but we have even less information about nutrition in the postpartum period, especially when you are active. And so there's a study, or actually more of an opinion piece, that came out a couple of years ago, which was talking about fueling for both lactation and exercise in the postpartum period. And what we're starting to understand is that if you aren't fueling sufficiently for both the exercise you want to do, but also to be able to sustain lactation, that breast milk supply and quality will start to change. So nutrition is essential, hydration as well. So that's something we don't talk about enough. A lot of people don't drink enough water anyways. When they're exercising, your needs are going to increase even further. And you would know better than anybody else that when you're lactating, hydration is even more critical. So
yes, I'm one of those people who are guilty of not drinking enough water, for sure.
Me too.
Yeah.
Most of us are.
Yeah. And I think the challenge for lactating parents too is that they realize that there's this caloric need during lactation, especially in those early few days and weeks where we need an extra 300 to 500 calories per day. And then if you're thinking about exercising on top of that, it's like, how do I manage this huge intake that I'm going to need? So yeah, tricky.
Absolutely. It's a tough one for sure.
Yeah. So I often try to give parents some ideas of different foods to eat that are quick and easy and not too much preparation. So, because there is a worry of, like you said, that milk supply decreasing because their exercising is causing that deficit.
Absolutely.
I did some reading as well, and I understand that there's a lactic acid a component in the exercising and breastfeeding piece where your breast milk can actually taste different to your baby, and they may refuse the breastfeed after exercise.
So yeah, great question. There's some of the very early studies did actually show that, and so they were measuring lactate in breast milk to see if it, actually increased. So lactate is, as you said, it's an acid, so it can change potentially the taste of the milk. But what we're seeing is that a lot of times that with our systematic review and meta-analysis, when we actually included newer studies, that we actually didn't see that relationship. Anecdotally, we certainly do. But often what we hear, especially with our athletes, is questions about, is it the taste of the milk or is it the fact that I'm still quite sweaty at the same time? And so, but based on the data that we have right now, we don't have those same concerns as that original study that came out talking about high levels of lactate.
Okay, interesting. Good to know. Yeah, so really the advice for parents would be, as always, follow your body, follow your baby, hydrate, eat enough food.
Yes,
Yeah,
absolutely.
yeah.
Hmm.
Wonderful. Is there anything else that you'd like to add on that study that we haven't talked about?
Yeah, so one of the things that we don't think about enough as well is support for your breasts while you're exercising in pregnancy and postpartum. So certainly, at least my experience is that your breast shape and volume can actually change very rapidly. And so if your breasts are actually quite full before you go for a walk, or we actually see greater concerns with running, especially that we do recommend that you feed your baby or pump before you go for the run, just to help to improve the overall comfort. But then the second piece to go along with that is making sure that you have supportive bras that are not going to be binding while you're running, but are appropriately supportive so that you can still have some breast movement as you are going out for those, especially like running or higher impact activities, but still allow some movement and comfort as well.
Great tip. Yes. And I think it's important to remember to remove the bra as soon as possible too, to decrease that compression.
Yeah, that's a great point.
What else are you working on right now?
Well, we can actually dive into some of the physical activity guidance for the postpartum
I
period
would
if
love
you like.
that. Yeah.
So, with the 2025 Canadian guideline, before we actually started this entire process, we surveyed, I think, over 300 postpartum women and their healthcare providers, but really specifically trying to find out what was most important to women in the postpartum period. So, the two key things that came out is one, focusing on mental health and finding ways to be able to support mental health in the postpartum period. And then the second one was to be able to help support sleep. So anybody who has had a young baby is probably very familiar with the sleep deprivation that comes with it. And especially if you are lactating, most babies are up fairly frequently, or at least that was my experience. And so keeping those two key points in mind, we did large volume of research where we synthesized or lumped together all available information about physical activity and sleep, and looking at key health outcomes. And what we found, especially when we're talking about mental health, being physically active in the postpartum period was associated with a 45% reduction in the risk of having depression. Even if you didn't have depression postpartum, depressive symptoms, so those like feelings of sadness, or what we would kind of call baby blues in the early postpartum period, those symptoms were actually reduced when you were physically active. And then the other piece to go along with mental health is that, again, we were interested in the timing of physical activity. And so while we know that everybody's journey postpartum is going to be quite different, we do know that there's an increased vulnerability for mental health concerns, especially depression, in those first 12 weeks or the fourth trimester. And so what we found is that restarting physical activity in those first 12 weeks actually had a greater impact in reducing the risk of depression than if you started later, which again makes quite common sense because if you're at higher risk in those first 12 weeks, you would expect to see a greater reduction overall.
Oh, that's wonderful. Yeah. I think it's so important to look at these correlations between exercise and breastfeeding and sleep, especially because oftentimes, colleagues of mine, we often talk about how breastfeeding is often blamed for mental health. And so it's really important that we look at all the other aspects in a person's life. Like, are you getting exercise? Are you getting support? Are you getting enough food and those sorts of things? So
Yeah, absolutely. And it's funny because, I think we have such a basic understanding about the postpartum period. Up until very recently, we often thought about postpartum as, you go from being pregnant and the next day you go through childbirth and you are simply non-pregnant. But we're really starting to reflect on the unique considerations of the postpartum period, such as sleep deprivation, lactation, pain recovery, what have you. But when we talk about breastfeeding, so by training, I'm actually a cardiovascular physiologist. So I look at the cardiovascular health of moms. And so there's actually some pretty good data that I'm sure you're quite well aware of, but your listeners may not be, that engaging in lactation and breastfeeding in the postpartum period is actually found to be supportive of overall cardiovascular health as well. So, certainly baby might be waking up to feed more frequently, but it can also support other aspects of your health, exactly as you suggested.
Yes. Yeah, it's far reaching. Absolutely. Yeah. Yeah, I'm actually in the middle of taking a sleep certification, infant sleep certification. So,
fabulous.
And I sought out, there's not very many programs out there that avoid sleep training. So this was one of the few that do that, and they're very evidence-based. They're very biology-based. They have Dr. James McKenna, who's lecturing for them. It's just so fascinating and so helpful. And being a parent myself, I remember that sleep deprivation. And if there was somebody able to give me this type of information and say, these kinds of things help, and this is how we can shape your breastfeeding and your mental health together without choosing one or the other, right? I think it's really valuable.
I completely agree. And I think there's been this long-standing, when we talk about sleep deprivation postpartum, it's one of those things where you actually just have to suffer through it, or you can do sleep training. And, for some people, it works fantastically. I did try it. I was on the porch just sobbing. Yeah. It did not work. My second actually slept for about 4 weeks and was a beautiful sleeper. And I just thought I won the lottery. Yeah. And then she woke up and didn't sleep again for a couple of years. But I would have been desperate for any form of information. And so, going back to the key things that women wanted in the postpartum guidelines, sleep was a major piece. And so we did look at the impact of physical activity on sleep in the postpartum period. In the guidance, we don't make specific recommendations that you must sleep, 7 to 9 hours per night, because there's no evidence available at this time to support it. What we did find is that engaging in physical activity did actually help to support overall sleep quality. So moms were, maybe not sleeping as long as they would like to. They're certainly waking up pretty frequently, but when they were asleep, that they actually slept better and had better quality sleep. We also know that higher quality sleep is associated with a reduction in the risk of having depression. And so that was another encouraging fact that I wish I had known back when I was suffering through those early days. Yeah,
it just makes so much sense, because even myself, my oldest is 16 years old, but I need my exercise for my quality of sleep even now. It just helps me fall asleep easier. So that makes perfect sense, because sometimes there's that postpartum anxiety where you're lying there and you're thinking about all these things, intrusive thoughts, things that could possibly go wrong. And I would think that exercise could make a big difference for that.
Yeah, absolutely. And we did see, I talked about depression. There's much less evidence about physical activity and anxiety postpartum, but we did see improvements in symptoms of anxiety for sure.
Right, because it would take a full spectrum of resources and tools, I'm sure. It's not just exercise.
No, definitely not. It's one component for sure.
Yes, yeah. And I think, you touched on this earlier, but I think it's important for parents to know too that it doesn't have to be this major, breathless exercise. You can go for a walk around your block, something really simple, stretching on the floor, find a postpartum class nearby you. There's lots of things that you can do that doesn't have to be exerting.
Absolutely. And actually, one of the key findings that we had, is talking about engaging in 120 minutes of moderate to vigorous intensity physical activity. So that really does include, and a lot of the data that we have is based on walking. But what is a little bit sort of buried within the guideline is that engaging in 80 minutes per week, so just over like 10 minutes per day, that if you go for a 10-minute walk every single day, that you see at least a 25% reduction in the odds of having depression. So
Wow.
really anything is better than nothing. If you're not able to do those full 120 minutes that we recommend, even a few minutes a day can help to support overall health, especially when we talk about mental health.
Wow, that's a big difference for such a small amount of time. Yeah.
It really is.
Wow.
Yeah.
Yeah, and I would imagine that also bleeds into the relationship with the partner. So valuable in all aspects of your life.
Yeah, absolutely. And it's funny because once we put together the actual recommendations themselves, knowing that sleep, at least, when I was in the throes of sleep deprivation, if anybody had tried to tell me that physical activity at that particular point in time was going to help with my sleep quality or doing whatever intervention, I was not in a place to be able to listen to it. So giving that information, before you're in the throes is really helpful. Before you get pregnant even is ideal. But what we heard really frequently is that the women need and want support, certainly from their partner. That's essential. We know that. Certainly from family and friends, but also from society. So one of the things we often hear about postpartum is that, you're on maternity leave, you're basically on a vacation, but anybody who's been on maternity leave, knows that that is not actually the case. And we need to value that time in the postpartum period to be able to help support mom, to be able to make these small changes that if she doesn't have the support to do it, it's simply not feasible.
It's true. Yeah. So write to your local MLA and your write to your government.
Well, we're very fortunate in Canada. We have
are.
at least the option for 12 or 18 months.
Yes.
A lot of my American colleagues just don't, and I honestly don't know how they are able to get through.
I don't know either. And it affects breastfeeding rates,
Oh, massively.
big time. Yeah. People who are listening to this now and they're like, oh, I guess I should really start planning my exercise routine for after baby comes, but can I do that in pregnancy? Maybe they're pregnant right now and they're worried about their activity level. Do you have recommendations on that?
So what we do, so I actually work a broad spectrum of pregnant and postpartum women. So people who have what we call contraindications, so medical reasons why exercise may not be recommended. So, women who have preeclampsia or congenital heart disease, but right up to women who are professional athletes as well. And so I would say that some of the biggest sort of changes in our understanding about physical activity postpartum and the reason why we are sort of more accepting about this early return to activity before that 6-week mark is because of these pro athletes. And so what we've been starting to do as we build out frameworks about how to think about or conceptualize physical activity in pregnancy and a return in the postpartum period is that we really strongly recommend thinking about what you envision for the postpartum period. So talking about, the importance of recovery and that you might experience tearing or you might be planning for a vaginal delivery but have an emergency C-section, which will have different challenges and, in terms of your return to activity postpartum. So within the guideline, we do, again, talk about this idea of individualization. So certainly in terms, we've talked about the timing, but also about how you actually return to physical activity. A few years ago, there were some physiotherapists who proposed that we don't view childbirth as an injury, but we treat the rehabilitation after childbirth as we would an injury. So that's rebuilding your foundations, waiting until there is a certain level of recovery. The bleeding has stopped, the incisions have appropriately healed enough to be able to rebuild your foundations again. And once you have those sort of baseline activity has resumed, that you can gradually and individualize the return to higher intensity, longer duration activity if that's what you desire.
Wonderful.
So really focusing on everybody has their own pace that they're going, and not comparing yourself to a pro athlete who returns really, really quickly. It might take you multiple months or, even multiple years to get back to where you're hoping to.
Absolutely. And I think age would definitely have a piece of that. There's a lot of families who are starting a little bit later in life, and it can be a little bit longer to recover from that. Would you have any knowledge on the use of vaginal estrogen in terms of postpartum recovery? And
oh, you know what? That didn't come up in any of our systematic reviews, and nobody was asking about it. However, I do work with a number, two specifically, pelvic floor physiotherapists. And Sinead Dufour has talked to me many times about vaginal estrogen. She's a great proponent for it. But that is about the extent of what I know, and I have no idea about.
Well, maybe I'll have to reach out to her then.
Activity.
Yeah.
She's fantastic. She's a wealth of knowledge.
Awesome.
So, yeah, definitely.
Yeah, that's something that I'm really curious about, because we do see the genitourinary syndrome of lactation. Just on its own can happen. It can affect the perineum and vaginal dryness and all sorts of things just from breastfeeding and that lack of estrogen. And then as we get into the perimenopause years and we're lactating, I feel that the vaginal estrogen could be a helpful thing. Mm-hmm.
Yeah, you definitely should talk with her. She's has similar thoughts, I think.
Cool. That's great. Yeah, because I get so frustrated when people are like, just quit breastfeeding then. That's not the answer.
Yeah. And I mean, everybody's, choices about lactation are going to be very individualized, but it really should be coming down to what their choices are and finding ways to support them.
Is there anything else that you think would be helpful in telling our listeners about?
No, I think those are the key points, is really focusing that you have your own journey. The return to activity is going to be individualized in terms of timing, the how and the when.
Yes.
And so, honor your own journey.
Absolutely. Great. And so where can people find your work?
So we have a website, exerciseandpregnancy.ca, but I post sort of the latest information and research on my Instagram, so at Dr. Margie Davenport.
Wonderful. I will link those in the show notes. Thank you so much for joining me today.
Thanks for having me.
Thanks for tuning in today. Be sure to check out the links in the show notes, and if you'd like to support the podcast, feel free to buy me a coffee. See you next time.